Hi, everybody. We're clinical correlation group number 13, and our system was the liver. I'm Abby.
I'm Naya.
I'm Jocelyn.
And I'm Jessica.
So what exactly is the liver? The liver has lots of responsibilities in the body, and it can be found on the right side, just under the ribs here, as you can see in that picture right there. One of the three main functions of the liver is one is to produce bile, and bile helps carry away waste as well as just helps digest fats. A second thing is that it helps filter blood, so it helps filter out the toxins and all just the unnecessary things that we don't need. And lastly, it helps store vitamins and minerals. So the first disease we're going to be talking about is Wilson disease, and I'll be going over the causes and the symptoms. So in simple form, Wilson disease is a genetic disorder in which excessive buildup of copper is found in the liver. So right here on the right in that picture, you can see this is a rhododendron staining, and all of those darker little spots that the arrow is pointing to are just copper deposits that is found, just excess copper deposits. And despite it being a genetic disorder, what exactly causes Wilson disease? Well, researchers have found that mutations in the ATP7B gene is what ultimately causes Wilson disease. So that gene is a protein producing gene that produces ATPase 2. And what ATPase 2 does is it transports metals in and out of cells as well as just to other parts of the body. And these proteins can be found in the Golgi apparatus, found in the hepatocytes right here. And something that's special about these cells is that most cells only have about one Golgi apparatus, but there are many layers of Golgi apparatus in these cells. And so there's over 250 gene mutations. And so a lot of them are just missing parts of the gene, or it's just altered in some way that prevents the carrying out of the copper or any other metals, therefore leaving excess amounts in the liver. Some of the symptoms that can be found with Wilson's disease is inflammation of the liver, which is also hepatitis, fatigue, which is tiredness, a yellowish tint to the skin is very common, and that's also called jaundice. There's also some neurological factors that can be shown, such as speech, tremors, and hard time swallowing, and just fine motor skills and things like that. And then one of the biggest signs of Wilson's is the Kayser-Fleischer rings. So in this picture right here of the eye, you can see there's a copper colored tint around the eye, and that's just due to the excess buildup of copper.
So for treatments for Wilson's disease, there are three common types. Unfortunately, there isn't a known cure since it is a genetic disease that you inherit from your parents. So there really isn't a known cure. But there are many successful forms of treatment that you can get prescribed from your doctor, including penicillamine or triamine dihydrochloride, which removes copper from your blood via urine. This is a very mild form of treatment, so this would be prescribed to you if you are showing mild symptoms. Zinc salts is another one. This is also a more mild form of treatment if you are experiencing symptoms. This prevents copper from being absorbed into the blood, therefore causing toxicity in your body. And then the third type is tetrathiomolybdate, which makes copper non-toxic to your body, and it also prevents the copper from being absorbed into your blood. Depending on the severity of the disease and what your doctor recommends for you, they will prescribe different increments of each drug to be administered. Some may be ranging from 4 to 6 months, and they may rotate between either zinc salts or penicillamine, or different combinations of these zinc salts like zinc acetate and the triamine dihydrochloride. If you are a critical patient, you may be required to receive a liver transplant. This is if you do have a lot of scar tissue in your liver and the disease is caught too late. And also pregnant women and children will be recommended to use these zinc salts more than the other forms of treatment, just because it is a less aggressive form and it is more good to your body. And the chances of getting this disease, like I said earlier, are a little bit more rare just because it is genetic and you have to have two carrier parents in order to have a chance of getting this disease. As you can see in the picture on the right, you have two carrier parents. You have a 25% chance of getting a normal child, 25% chance of getting an affected child, and a 50% chance of getting a carrier child. 1 in every 30,000 to 40,000 people get this disease. So again, it's very rare, just with the chances of having a husband and a wife having this disease as a carrier is very slim. So it's not very common. And chromosome 13 is the actual chromosome that is responsible for the creation of this disease.
So what is cirrhosis? Cirrhosis is the last stage of what is called fibrosis, which is the scarring of the liver. If you look on the picture provided, the liver on the left is healthy, meaning there's no scarring tissue, while the one on the right is covered by nothing but red and orange color bumpy texture, which is the scar tissue. What are the causes of cirrhosis? Many conditions cause cirrhosis. Among the main causes are alcohol abuse, hepatitis, which is the inflammation of the liver, fat that accumulates in the liver, and iron that may build up in the body. A few of the most common symptoms in cirrhosis are yellow pigmentation in the skin and the eye, also called jaundice. The other symptoms are bruising easily and vomiting of the blood. For its diagnosis, cirrhosis can be diagnosed with computed tomography, ultrasound, and/or with a biopsy of the liver. There are currently no treatments to cirrhosis because the scarring of the liver is irreversible. However, there are ways to prevent cirrhosis, from which those include limiting alcohol consumption and eating in a more balanced diet to decrease any chances of fat accumulation, which can later lead to cirrhosis.
So the plan of prevention often depends on when the scar tissue is discovered. So obviously, the sooner you discover it, the better it is for the patient. If it's discovered in stage 1, then there's a 15 to 20 year life expectancy. If it's discovered in stage 2, then it's less, 6 to 10 years. And if it's discovered in stage 4 or the final stage, it's typically 1 to 3 years left in your life. Life expectancy also depends on the cause of the patient's cirrhosis. So the plan of prevention changes based on the type of disease causing the scarring. For example, if you have diabetes, then changing your diet helps. And if the inflammation in your liver is due to alcoholic hepatitis, then limiting your alcoholic consumption would be better. We do have vaccines against hepatitis A and B, but the autoimmune form of hepatitis is when the immune system attacks itself to cause inflammation, so we don't have a cure there. A side effect of cirrhosis in the liver is portal hypertension, and this is most commonly seen in patients with diabetes and cirrhosis of the liver. So hypertension means high blood pressure, and this image helps explain. It looks more complicated than it is. Basically, as the scar tissue progresses, the vein architecture in the liver becomes increasingly compromised as the veins thin out, which means that it's harder for the liver to get oxygen, and it just complicates the whole process for all of the functions that the liver has to carry out. Ultimately, this puts more pressure on the veins, and so diabetes from bad diet can add to the pressure on the blood system in the liver. And then if we go to the next slide, you'll see scar tissue in cirrhosis. So this top picture on the left shows early signs of cirrhosis. You can see the blue represents scar tissue, and then the pink is healthy tissue. The less fat globules there are on the right side is evidence of more severe cirrhosis. And this is because as cirrhosis progresses, it's harder for the liver to metabolize fat in the proper way. And then this image of the liver on the left is stage 4 cirrhosis. So this is pretty much irreversible at this point, and it leads to a symptom of edema, which is a buildup of fluid in body tissues. The liver shrinks and then hardens. And then on the bottom right, we can see in this image of the tissue, there is lots of pink tissue, so the liver is probably in stage 1 or 2 of cirrhosis, and this is an image on 10 times power.
So for this exam question, it's asking the yellowing of the eye, jaundice, is a symptom of which disease? A, Wilson's disease, B, cirrhosis, C, A and B, or D, none of the above. And from what we learned from the previous slides, both Wilson's disease and cirrhosis have the symptom of the yellowing of the eye. So the answer would be C, A and B.
So for this exam question, it's asking which of the following treatments will be recommended for a young pregnant woman with mild symptoms of Wilson's disease. So if we think back to when we were talking about treatments of Wilson's disease, the most mild form of treatment is going to be any type of zinc salt like zinc acetate combined with nothing else, just those zinc salts. So the correct answer for this question is going to be B.
For exam question 3, it says which of the following can contribute to cirrhosis? A, chronic alcohol abuse, B, metabolic or autoimmune disorders, C, hepatitis, and then D is all of the above. And if you look at the image on the right, you can see the veins in a normal liver and then the veins in a liver with cirrhosis. So the answer is going to be D, all of the above, because these are all causes of cirrhosis.